dense breasts. Let's start by clarifying a few important things. Dense breasts aren't always larger breasts with more fatty tissue. That has nothing to do with it. There are other factors that are also important to remember. When you're younger, your breasts have the perfect balance between fatty tissue, glandular tissue, and fibrous tissue. As you reach menopause, your breasts become more dense. You have more glandular and fibrous connective tissue, and less fatty tissue. When performing a mammogram on breasts that have higher density, the results can be more difficult to read and interpret than those who have less dense breasts. Dense breasts, something to check and keep in mind. According to several studies, such as this one published in the journal The Annals of Internal Medicine, women with greater breast density are at a higher risk for breast cancer. Again, we'd like to highlight that this is an additional risk factor. It's not a guarantee, but something to keep in mind. For that reason, you should talk with your doctor about getting mammograms on an annual basis instead of every 2 or 3 years. Don't be alarmed. 1 in 4 women have dense breasts. The breasts are made up of 3 types of tissue: glandular, fatty, and fibrous. When you have dense breasts, it simply means that the ratio of fibrous tissue to fatty tissue is higher than usual. While it's true that the statistics have this factor to consider, there's another much stronger determinant: your genetic history. If you have no cases of breast cancer among your mother, aunts, or sisters, your risk of developing breast cancer because of having dense breasts alone is low. But don't wait, it's still a good idea to have a mammogram every year. That way, you can feel much more at ease. When do you develop dense breasts? As we said earlier, you probably won't know if your breasts are dense or not. However, there are some risk factors that determine this occurrence. Menopause. Due to metabolic and hormonal changes between the ages of 50 and 55, the breasts will lose that balance between the glandular, fatty, and fibrous tissues. Also, if you lead a sedentary lifestyle and gain weight, your risk of developing dense breast is higher. The genetic component determines whether or not your breasts, over time, will become more dense. Keys to preventing breast cancer in dense breast if you have a family history. At the beginning of this article, we mentioned that if you have a genetic history of breast cancer, your risk of developing this disease increases. In this case, preventative measures are necessary. But your doctor will always be able to recommend the best strategies according to your personal situation. If there's a genetic component, hormone replacement therapy may be the most appropriate. You can't ignore the fact that if you have dense breasts, and any female relatives who have suffered from breast cancer, your risk is 3 times higher. Guidelines to follow in all cases. Don't smoke. Avoid becoming overweight. Don't lead a sedentary lifestyle. Stay active through aerobic exercise. Avoid a diet that's high in saturated fats, white flour, sugar. Follow a Mediterranean diet with abundant amounts of fresh fruit, vegetables, and healthy fatty acids, such as olive oil. Drink plenty of fluids.